Good evening, I'm Lizzie Siles, and thank you for joining us for 25 News at 9. Now, many of the votes that Americans will take on Election Day will have a direct impact, but not all of them. Now, that's because Illinois voters will see advisory questions, which work kind of like an official poll. Jolie Rodriguez explains one of those questions regarding more access for reproductive health care.
In the United States, about 11% of women and 9% of men have experienced fertility problems. This election cycle, state legislators are asking, should all medically appropriate assisted reproductive treatment, including but not limited to in vitro fertilization, be covered by any health insurance plan in Illinois that provides coverage for pregnancy benefits without limitation on the number of treatments?
So the absolute costs of what we do are actually not quite high when you think about medical costs. It's that they're not covered.
Dr. Jenny Hirschfield-Citron adds an IVF patient on average could spend around $15,000 on treatments. Voting yes on this question supports the potential referendum. Voting no opposes it.
It allows voters to weigh in through a non-binding advisory question that would give clear guidance to their legislators in Springfield, including myself, as to the importance of ensuring fertility treatment is accessible to women across Illinois.
Opposing group Illinois Right to Life is urging people to vote no on the matter due to the moral concerns.
There is the creation of so many embryos that are not used. Because we believe that life begins at the moment of fertilization, we believe that those babies deserve a right to life as well.
Dr. Hirschfield-Citron says fertility treatment access has been overlooked for far too long when so many people are affected.
Being a parent should be something that's limited to certain people that have access to care, whether it's because they can afford it, they're in a state that provides coverage, or politically it's there. This is a medical illness. This isn't an elective thing that people opt for. It'd be really challenging to live in a country that proposes to provide the best care in the world, and that we would limit people to a treatment that helps 1 in 6.
For 25 News, I'm Jolie Rodriguez.